Weak hip flexors. Remember the kidney meridians go right up through the hips, right up through the hip flexors. And low back pain because the hip flexors keep your hips flexible. And the hip flexor muscles, remember, help you flex your hips, but they insert in the lower lumbar spine. So if they're weak from the kidney infection, you're going to have chronic low back pain, especially those flank areas I was talking about. You won't be able to twist back and forth, or you won't be able to lift your leg, or you won't be able to get a good stretch whenever you're doing any stretching or yoga. Kidneys can create that. Kidney problems can. Swelling in the ankles, fluid balance can cause swelling in the ankles. We have indentations around your ankles. Or when you hit a certain altitude up in the air, you can have more swelling in the ankles because the kidneys aren't working at proper rate. Bags under the eyes, dark circles under the eyes are a huge indication of kidney fatigue. Cracked heels, here's a big one. The heels, now you will see that the heels in themselves, if they're cracked, if there's some form of problem within those areas, it's because the bladder meridian runs right through the heels. So if you have dry feet, if they ever get ashy, or if you have cracks that have been there for a very long time, I've seen many patients that have had indications of viral infections and bacterial infections from your analysis, from my examination, that are occurring in the bladder, and you work with herbs and clean them up, and their heel cracks start to go away. Bladder, kidney issues can